Okay.
Okay.
It works.
Well, I will start welcoming. We have 5 attendees so far, but they are joining. It is exactly 2 o'clock our time here in Belgium. In wherever part of the world you are, either good morning or good evening already. Welcome to this valuable webinar on education, and especially directed to students who, we have a larger student membership within the International Society for Telemedicine, and there are a lot of issues that are dealing with education. Education is one thing we recognize as a major player for the future of telemedicine, digital health, as we call it now. So welcome, and I had welcome to all the others that will join us. I would like to leave the word to Dr. Adolfo Sparrenberg, who is also the coordinator of the students' memberships within the ISfTeH, who will also give you a small overview of the activities of our international society. Adolfo, go ahead.
Okay. Just uploading my presentation. Good morning. Just a second, please. Yes, I hope you can see the PowerPoint now.
Not yet.
Not yet.
Yeah, I think you have to double click in the file.
Yeah, but that was. And now?
Yes.
Yeah.
Okay. And you can hear me. Okay. Good morning, good afternoon, and even good evening for those that are located in different countries of the world. So it's my pleasure to participate. Thank you very much, Mr. Frank Levis, for the introduction. Dear colleagues, dear distinguished speakers, dear Dr. Jefferson Fernandez, the coordinator of the education program of the ISfTeH, dear students, partners, and affiliated members of the ISfTeH, it's our great pleasure today to have the webinar on the theme of digital health initiatives in education. So our very special distinguished speakers will be Professor Alexandra Monteiro from Brazil, Professor Pirkko Kuri from Finland, Professor Valery Stoliar from Russia, and Professor Saroj Mishra from India. So it's important to inform at this point that this session transmitted via Zoom will be recorded. So the content of the slides and the respective audio will be available to those colleagues that for some reason couldn't attend the live session today. So the access link to the recorded session will be informed in around 24 hours, and that will be posted on the ISfTeH website. So also during this session, a chat box will be available on the screen. So your comments and questions are quite welcome. And at the end of the presentations, we'll have a time interval of around 15 minutes for discussions. So please use the chat box for that. And before going through the outstanding topics of today's webinar, it's my mission and honor to say some words on behalf of the ISfTeH, mainly directed to those colleagues and partners that are not yet familiar to the ISfTeH. So next slide. Well, it's not. Okay. The International Society for Telemedicine and e-Health was founded in 1997, exactly 24 years ago in Japan, in Kobe, Japan. And the mission of our society is mainly to facilitate the international dissemination of knowledge and experience in telemedicine and e-health, at the same time providing access to recognized experts in the field. So that's the value of this education session today. The headquarters of the International Society for Telemedicine and e-Health is located in Basel, Switzerland. and our society is a non-governmental organization as well as a non-for-profit, democratic and neutral organization in official relations to the World Health Organization. Currently, the society has affiliated members from over 100 countries, as you can see, in all continents, distributed in different membership categories, like this slide shows: national, associate, institutional, corporate, individuals, and corporate startups, and nurse and students. That's important to mention that nurse and students represent special categories that are free of charge. So students, that is the case for today, can affiliate if they have up to 35 years old and up to the end of the MSc program. Students of PhD, doctors, professors should affiliate individually. The society counts on the support of several working groups, as we can see listed in this slide. And the working groups are in fact a very important segment of the ISfTH, composed by colleagues that are responsible for organizing practical activities throughout the year. Webinars like today's session represent a key component of these initiatives. The ISfTH organizes and supports a series of international conferences every year that usually rotate around the world. Unfortunately, in 2020 and in the current year, due to the COVID-19 pandemic, some ISfTH conferences were canceled or took place virtually, like the 25th edition of the ISfTH International Conference, originally planned to take place in Japan, Takasaki, but that finally was held virtually this year in February 2021. The next edition, the 26th International Conference, is expected to take place in Dubai, the United Arab Emirates, in early 2022. We hope so. Also, the ISfTH organizes an annual program of webinars, a very successful initiative that started several years ago, as we can see demonstrated in this slide. The sessions have the same standard of today's webinar, covering several topics of telemedicine, e-health, and digital health, including the participation of many working groups of our society. This is an example of a telenursing session held some time ago. Other important activities organized and provided by our society include the official newsletter and the journal of the International Society for Telemedicine. The journal is composed by an editorial board by Professor Maurice Mars from South Africa and Richard Scott from Canada. Also, a lot of scientific, and academic information can be found on the ISfTH website through its several chapters. So affiliated members are invited to read the scientific content and to actively bring a contribution to both the newsletter, the journal, and the website. It's really worth a visit. At this point, there is something now. It's an outstanding initiative organized by the ISfTH. We are talking about the ISfTH education program, a specific chapter coordinated by our colleague, Professor Jefferson Fernandez. That comes with the expectation of running a comprehensive program, counting on the participation of all ISfTH working groups and affiliated members, as Professor Fernandez will explain soon after this introduction. So those interested in joining the ISfTH can affiliate through different membership categories. You are all welcome. Students, as I mentioned, up to MSc degree, and nurses are free of charge membership categories. In order to be accepted, students are requested to submit a copy of a valid ID card or a certificate that he or she is pursuing studies in the current year. So requesting affiliation is really a quite easy and simple process. You just need to visit the ISfTEH website and go directly to the How to Join area, where an intuitive request form right now waits for you. Finally, the last but not the least, this is the ISfTEH website where all this information is fully available. So I thank you very much for your attention during this introduction. And right now, I'm very pleased to invite our colleague and director of the ISfTEH education program and co-chair of this session, Professor Jefferson Fernandes. So, Professor Fernandes, welcome.
Thank you, Adolfo, for this kind introduction. Welcome to our speakers and all of the attendees that are here today with us. As Adolfo mentioned and previously Frank Levin said also, due to the importance of the educational role of the International Society, early this year was taking a decision to create this education program. And I had the honor to be appointed as the director of such program. And the goals of this education program are several. A general aim is to coordinate and manage the overlapping education activities of all the society organs. And we have, as Adolfo has mentioned, the different components of our society. And the education program has 4 main components: the working groups, and we'll support in the best way possible the educational actions of the working groups of our society. Also, CONEDIC, it's a consortium of educational institutions in digital health, and it operates under the umbrella of the International Society and now also under the education program. I'm going to have here with some presentations something that is related to this consortium. And of course, the student members, that it's a special subsection. And with that, we recognize the importance of the students for the future development of digital health and the need of their education in this field. And Dr. Adolfo Sparenberg is the students member coordinator. And we have a 4th component, which is education projects. All projects that are not included in the previous components I have mentioned. And they can also be developed in partnership with other institutions and organizations around the world. So I reinforce what Adolfo said. Those who are not yet members of our society, please go to our website and have a look of what we are developing and had developed in the past. And the International Society is the largest or the main or perhaps the only international society with all this with this approach and working around the world for the benefit and development of telemedicine, telehealth, and digital health. So thank you very much for your attention, and I'll give back the word to Adolfo. Please, Adolfo.
Thank you very much, Professor Jefferson. We wish you a very successful journey as a coordinator of the education program. Now, it's time to invite our first speaker, Professor Alexandra Monteiro from Rio de Janeiro. It's my privilege to say some words about Professor Alexandra Monteiro. She is the Vice Dean of the Medical School of the State University of Rio de Janeiro. She's also the coordinator of telemedicine and telehealth postgraduate program at the same university, and also the scientific director of the Brazilian Society for Telemedicine and Health. So it's my enormous privilege to invite you to participate once again. Thank you very much for joining us, Professor Alexandra, please.
Good morning from Rio de Janeiro. Good afternoon, good evening. Thank you so much for the kind words about me. Adolfo has just said. It's a great pleasure to be here to share with all of you our experience from Rio de Janeiro State University, not from Brazil at all. but we have been working for a long time, and I will start to share. And firstly, I would like to thank Frank Leaves, my dear friends, also for the invitation. Here. It's okay? So Jefferson has already talked a little about me. I am the head of telehealth center from our beginning. And since last year, I am also the vice dean of medical school at Rio de Janeiro State University. State University was founded in 1930 and is located, is located in the southeast region of Brazil, just here, as you can see. Right off the bat, I would like to share with you and to bring up the fact that this year, UERJ has been ranked 8th place in the national rank by the Center for World University. It's a great honor for us. And to share again, share also our numbers of institutes. We are 33 schools, institutes at state universities, 1 unit for basic education, a lot of undergraduate courses and postgraduate courses. We have here 2 health units. One of them is a university hospital, campus and external main sites, libraries, and laboratories, as we are one of them, telehealth center. UERJ, telehealth center from UERJ was created in 2003, and we have been since then working on e-education activities for under and postgraduate students, as well for health professionals. In terms of research, we have developed systems to enable teleconsultations and telediagnosis, and we are now working to develop and implement new digital healthcare mobile solution. It's very important because we are a continental country. In addition, we had an extension program approved in the university back in 2011 for Brazilian and foreign students, a great opportunity to all of us to exchange in digital health. The next step we are planning is to have this extension program added to virtual exchange program. It is an international program which allows students to access online education for real academic credit from universities around the globe. So we are expected to have next month UERJ accepting the VEP virtual exchange, international virtual exchange program. For e-education, we use since the beginning a Moodle platform for online asynchronous education and other platforms like Zoom, just we are using now for live webinars. All of them receiving open online courses are free online courses available for students and or for healthcare professionals. This is our platform. You can access, it's free and open to access. We are almost, until now, 57,000 users, as you can see here. The online courses are organized by health areas such as psychosocial care, infectious disease, oral health, mental health, prison health, primary health, digital health. We create this year a special area to digital health, and so on. Last year, with the outbreak of the pandemic, we created a new category to address COVID care, as you can see here, providing courses and guideline materials such as this, including infographics, podcasts, and videos for health to orient health procedures. Our results from our target audience, they are located in all the Brazilian states and in different countries around the globe, although all the education materials are available only in Portuguese language, as you can see in the maps. Here is Brazil from the north to the south, and a map from the globe. It's very nice because we really don't know if they are Brazilian people around the globe or from Portugal or people who need to know about the language Portuguese. Since 2011, we have a specific project in place for health education at school, which is developed with the undergraduate students of the Unit for Basic Education High School, CAP UERJ. The students speak a term and do the research under supervision of professors from UERJ Medical School, as me. I like very much this project. It is a fantastic experience since it gives the students the opportunity not only get information on how to prevent and promote healthcare, but also to learn the first steps in research. We did till now child obesity, asthma, TRASH, how to deal with TRASH, Zika, dengue, diabetes, tuberculosis, dengue, Zika, and chikungunya. We have problems here in Brazil related to this disease. To concern the extension program in digital health, medical, we can give you some more points or more details about medical academic leagues. Academic League is a no-profit association of students by self-initiative with an indefinite duration with the object of exchange experience and knowledge with communities outside the university, outside the UERJ, locally, nationally, and or internationally. UERJ Telehealth Center Extension Program gives support initiatives for two leagues, Academic League on Innovation and Telemedicine and Academic League on Financial and Entrepreneurship in Healthcare. Both have been doing a great job by using online social media with the YouTube channel standing out, as you can see here. This year, to our proud of, the League of Innovation and Telemedicine was one of the co-founders of the Brazilian Digital Health Program Leagues at Brazilian Association of Telemedicine and Telehealth. I think I am now the scientific director of ISfTeH, as Adolfo has told at the beginning, and Jefferson is the vice president. So if Jefferson at the end can give more details, it's very important to share with our international students. Our postgraduate program on telemedicine and health was approved in 2014 here in Brazil. Before, it has been approved at UERJ and after by CAPS. CAPS stands for Coordenação de Aperfeiçoamento de Pessoal de Nível Superior, which in free translation means coordination for the improvement of graduate personnel. It is a foundation associated with the Ministry of Education in Brazil, which authorizes, evaluates, and certifies annually all postgraduate programs in master and or degree after they are approved at the university. Our master degree course is remote, only available in Portuguese for now, free of charge, designed for graduating from multiple professional areas, and has been certified, as I already told you, by both UERJ and CAPES. Our results today are a total of 133 postgraduate students at an average of 33 years. which have completed an average of 2.2 courses of master and or doctorate before getting our telemedicine and telehealth master degree course. More than half are female, and while we have professionals from 20 different areas, doctors, as you can see here, nurses and dentists prevail amongst the students, represent 61% of. They are located in different states here in Brazil, as you can see in the map, principally in Rio de Janeiro state, represents 56% of the group. Our first foreign students is from Ecuador. It's a very nice to have people around the world, but to get to our master program, it's obligated to have the proficiency in Portuguese language. Going to finish my presentation, Adolfo has already told about CONEDIC. Last year, for our pleasure and honor, we are one of the co-founders of the Consortium of Education Institutes in Digital Health at International Society for Telemedicine and Health. It's really an honor, and we are very excited to engage in this group, to moving forward, to share and to provide digital health care around the globe. It's really a very proud for us. And I would like you also to invite all of you to our Brazilian Congress on telehealth, telemedicine and telehealth. It will be at the end of this year, from 2022 to 26 in November in this year. Here are the sites, as you can see. The language, it will be Portuguese and English, and it will be a pleasure to have you presenting your experience in our Congress and share with us. And getting to the end, I really want to thank you for your attention, and also again for the invitation of Frank Lives and Adolfo in Sparenberg, and to let a message that digital health, it's a great family, a wonderful family. We have a lot of friends, a lot of people, and we have to move forward to deliver healthcare to our people around the globe. Thank you, Adolfo. Thank you, Frank.
Thank you very much, Professor Alexander, for all these interesting activities that are currently available through the University of the State of Rio de Janeiro. It's really amazing. So now, traveling from Brazil to Finland, not so close, more than 10,000 kilometers. So, I'm very pleased to invite the Vice President of the International Society for Telemedicine and Health, Dr. Pirko Kuri, that is also the Vice Chair of the Telenursing Working Group of the ISfTeH, and also the Secretary of the Finnish Society for Telemedicine and Health. Dr. Pirko, welcome, please.
Thank you, Adolfo, and thank you for the organizers to have the possibility to join this important webinar. I'm so pleased to be here and discuss some experiences of Finland. And I will share now my screen so you can see. Can you see it? Adolfo, can you see it?
Yes.
Okay,
Yes,
thank you. Okay, thank you.
Perfect, okay.
Okay, so about the digital education and training of nurses and doctors after graduation in Finland. So that's interesting to see, because we have also the official degree programs at the universities, etc., from master and up till PhD. But I'm focused more about the different kind of education, which is not provided by the university specifically. So here you can see the statistics of Finland. We annual basis collect official data how we use internet among our citizens, and you can see it, especially the group of older people. The amount of older people using internet is growing fast, and this kind of information makes a good base to build digital services where citizens are involved. And also we have national projects which provide portals for citizens to learn more digital competencies. For example, Sotepida 24/7 portal, which has offer MOOCs in selected areas like basics of how to use ICT tools, ethical issues, privacy, data security, and how to behave in online interactions and that kind of stuff. And also you can see that the information related to healthcare, it's quite often searched from nutrition or preventive health issues. And also we have the National Archiving System and Prescription Center. So we have online services. For example, I know when I need my medication to be the prescription renewed, because I can see it. It's very handy. So here you can see the our National Institute for Health and Welfare follows many areas, and this is one recent report where how the virtual meetings are realized. And as you can see, the most time is during this COVID-19, and the trend is the same in Nordic countries like Sweden, for example. Though the statistic offers information on service providers, the use of services by customers and customers' health problems. So it's very good to see what is happening in the basics. And according to the same report, there was how the contacts were realized among different social and healthcare professionals. And the nurses, public health nurses, were the biggest group. And the doctors were the next one after nurses and public health nurses. And usually the contacts were more made by female than males. And the most common reason for visiting those virtual visits, according to ISfTeH classification, was contact with healthcare provider elsewhere for advice and medical advice, and for nurses based on the international classification of primary care classification, it was the health maintenance and prevention, the reason to contact a nurse or public health nurse. So the competence after building after graduation. I used to work at the Savonia University Applied Science, and 5 years ago I built the first online Master of Digital Health program. But I will here focus on what is after the graduation and not organized by Seoul University. So, for example, this nursing informatics certification we needed that because many nurses are working in some specialty area during their career, and they have studied many courses, for example, in e-health and telemedicine, and done a lot of development and training work in their specialty. For example, quite many digital initiatives in hospitals or healthcare center are realized via projects, and nurses participate in those projects, and they also have written articles and kept lessons and so. And this kind of was the reason why Finnish Nurse Association launched a special certificate system in Finland. And about 4 years ago, we finished the work with nursing informatics specialty certificate, which is approved by the Finnish Nurses Association. And of course, you have to be the member of the registered nurse first, and then you must be a member of the Finnish Nurse Association. And the evaluation is based on the portfolio, and the applicant has an application process where she or he must show what she has learned by working experience, formal education, and cooperation and development and work. And the application process, it takes, I think when you start it, then you have to collect 200 ISfTeH credits, and one ISfTeH credit is 27 hours. And it is collected, then you show what you have been, if you have published articles, if you have teaching activities, mentoring activities. So it's a kind of personalized portfolio, and then the certificate is valid for 5 years. And when we started, it was so new that you can see it was only 4 during those couple of years, but now the number is growing due to the digitalization of whole country. Then for the doctors, physicians, Finland, I think, is a forerunner in that sense. The special health competence for medical doctors, dentists, and veterinarians has been developed. And in Finland, you see in the right side, the medical doctor who is licensed physician in Finland, it takes minimum 6 years with basic and practical studies. And then you must have a specialist in certain area like surgeon, radiologist, dermatology or cardiology or whatever, and it takes 5 to 6 years. And you should have administrative activities, so how to lead things and administer. And when you are a specialist, then you can apply for this special competence in e-health, which takes around 2 years. And I'm happy to say that our society has established this system 2012, a special competence of healthcare information technology for physicians. And it was so, doctors around us were so interested, so that the Finnish Dentist Association joined us. And now the news is Veterinarians Association, and they also come to our conferences. And the competence is built, competence committee is established by our society, and we get some fee when they get the diploma or the competence. And I must say that Professor Jarmo Reponen has been the key person. He is also the vice president of our society, and he has been so active in building the competencies needed in the medical field. And as I said, the program is targeted to medical specialists with already gained experience in medical work. So they must have practice knowledge too. And the expertise is, we have the individual study plan, which is accepted by the competence committee. In the committee are, of course, from our society and from the medical association. And then they collect the learning portfolio, which a student keeps throughout the studies. And the target is that the graduate will achieve an extended perspective of digital health and serving healthcare, and also is capable of guiding this all development process, including electronic health record solutions and digital transformation services. And it's a pleasure to accept those diplomas or certifications or competencies when they have finalized that one. And actually now we have a new effort. Our society has done a consortium with Faculty of Medicine of University of Oulu, and we have established a cooperation in pioneering telemedicine training in Finnish conditions. And the very first one will take place continuing in service training of doctors. It will start in October next month, and the second phase will be scheduled on December. And then 2022 sections 3 and 6 will be carried out on quarterly basis, according to decisions of today's telemedicine committee's meetings. So it's a good push up to create the competence for our doctors as well. And here you can see a graphics. So we have nearly 140 special competence and participants or graduates, and most of them, of course, are physicians. And then are the dentists, and the newest is just, I think there's 1 or 2 veterinarians because they just started. because it takes 2 years, and they started that education as well. And I thank you for your attention, and warmly welcome you virtually join our conference, which will take place in 7th and 8th of October. And I'm sorry, there should be our web page, but I think you'll find when you go to our Finnish Society's web page, you find more information. I'm so sorry that it is not free of charge. You have to pay a registration fee, but in any case, you are most welcome. But thank you for your attention.
Thank you very much, Dr. Pirkko, for your interesting presentation. It's quite important to see that not just nurses and medical doctors, but also veterinarians and dentists are involved in this program. Yeah, congratulations for that.
Thank you.
Well, now changing again from Finland to Russia, it's my great pleasure to invite Dr. Valery Stolyar from Russia. Dr. Valery will speak about the experience of telemedicine education. Professor Valery is a professor of telemedicine. Yeah, at People's Friendship University in Russia, RUDN. Professor Valery, please welcome.
Can you look my presentation?
Yes, perfect.
Fine. Okay.
Thank you.
Dear friends, I have big experience in telemedicine really, because many years I work in the Bakolev Center of Cardiovascular Surgery. And last century, we started a telemedical project for distance video consultation for children with congenital heart disease. And after first year of our work, we understood that main problem is education of real physicians of the telemedical technologies. And now we have big experience for this education for students and for physicians. In my institute, I have students from 52 countries. And all our physicians and students after special education during 2 weeks must know, must understand why patient need telemedicine, why physician need telemedicine, why hospital from region need telemedicine, why professor, surgeon example, need the telemedicine, and why the big main, very famous federal center need the telemedical technology also. And after this education, my students must understand from his country how he can prepare the distance video consultation with best hospitals, with best universities, as example with RUDN University, and how he can or she can prepare the distance interactive education, as example, real-time transmissions of different kind of operations. Of course, I have, as you, some experience with Microsoft Teams, with Zoom and so on, but mainly for me, I think that more interesting the standard video conference, modern video conference, with good quality of video, with possibilities for at the same time to send 2 good images and so on. And our telemedical network based on the modern video conference. Here you can look our first experience 24 years ago. My friend, Professor Radkov, he's an astronaut and very good physician, had the first distance education for Yakutia. It's not so far as Brazil, but it's north of Russia, minus 72 sometimes in the winter, and very big territory, such as France, and only 1 million population. Here you can look our first experience for distance video consultations with Yakutia also. Maybe no, maybe not. We had no good channel. We had no internet in principle. And we use only the numerical standard for phone standard, ISDN, International Service Digital Network. But we had good result. Together with my friend Professor Mishra, we have some experience for education for students with, we like to invite the good specialists for this education from India, from Brazil, from Europe, sometimes from Japan, and so on. And it's very interesting because during this education, our students can ask immediately. It's interactive education. Ask, as example, Professor Mishra about experience, about problems, and so on. Also, you can look our experience with France, with Germany. We had very good relations with Regensburg University. And here you can look our experience with India, Germany, Brazil, China, and it's for our students, not only for physicians. Of course, it's very interesting to show our students real possibilities of telemedicine, real possibilities of real-time transmissions from different kind of operations. Here you can look ophthalmology, urology, cardiovascular surgery, and so on. And it's very interesting because in our auditorium, I can look the real picture of the open heart. I can look the same picture, some such as surgeon, cardiac surgeon. We have some interesting result with special field for real-time transmissions. We have special equipment, special helm for surgeons, for stereo images. For students, one video camera on the helm of surgeon, it's fine. Good picture, he can look the blood and so on, vessels and so on. But if I am a surgeon, I have my experience. I need the real picture. I need the stereo with real, because I need the, I want to look the details. It's our result, and if it's necessary, if some people walk, we can send this information. Of course, our students must look the real situation with distance video consultation, because real distance video consultation, it's not discussion face-to-face. It's discussion with all information about patient. Here you can look our experience with real-time transmission of ultrasound investigations for newborn, and some experience in the north of Russia after catastrophe. Sorry, but sometimes we have it. Here you can look very interesting example for distance video consultation. It's very interesting for our students because it's a discussion about newborn with congenital heart disease, and during video consultation, we can prepare the ultrasound investigations in real time with discussion, with questions, and so on. Of course, for our, you know that some our students from countries very far, from Africa, Brazil, north of India, and so on. And of course, we must prepare every time the special exhibition for video conference equipment, for telemedical equipment, for this situation. Here you can look a real example of our work, distance video consultation, nearly the ice ocean in the temporary village for fishermen. And here also you can look the same video consultation during the winter with helicopter and with special video conference equipment. Of course, during our education, we must prepare the special regulation, special rules, how our students, how our physicians must prepare information and questions for consultant, for real video consultation. I don't like examination really, and my students, after 2 weeks of education, must prepare 2 examples. Special group must prepare this real video consultation with special scenario and so on. One situation, discussion between 2 physicians from other countries, of course with patients. And second idea, video consultation between physician and patient. It's very interesting with jokes, sometimes without jokes. but it's a real experience, because after this example, our students can receive the real experience. They can receive the knowledge how they can prepare the real video consultation with real patients. Of course, we have some other experience for Space Lab, as example, because Professor Radkov is a real astronaut, and we had the special experience for telemedicine in the Space Lab. Here you can look my face. I was young, sorry. And for our students, it's very interesting example, because sometimes we can invite real astronauts for our education with special discussion, with special ideas, and so on. It's very interesting and very useful, important to explain our students idea of telecommunication, about equipment, about channels, and so on. As example, today we have the Zoom. It's very difficult to connect Zoom with video conference if I want to show the real operation, real investigation of real ultrasound investigation, and so on. It's very important, and I hope really that after 5, maybe 10 years, we can receive the same standards for different kinds of education. Here you can look my students during examination with real example, with consultation as examination, and so on. I really like it. Of course, it's very important to show our students real results of equipment, ideas, technology, and so on. Usually, we like to invite special companies who produce the video conference equipment and telemedical equipment to prepare the special exhibitions for our students. And after education, our students can receive the certificate official with stamp, of course, and so on. I think I want to add, of course, we have, I think, very interesting experience for distance education for students during 2 weeks and our physicians in Russia, and for some physicians from former USSR countries. And for me, it will be very interesting if you can take part in this education. And maybe it will be interesting for you to receive our materials, books, presentation, and so on. That's all. If you have some questions, I'm ready.
Thank you very much, Professor Valery, for this interesting demonstration of everything you have conducted in Russia in the last years, and mainly considering the aspects of teaching students and establishing connections throughout the country with this kind of new technologies. Perfect. Thank you very much for showing this and sharing this with so many students. Well,
Thanks a lot.
now the fourth presentation is a video recorded by Professor Saroj Mishra from India. Professor Saroj prepared a video presentation about the National Medical College Network, that is an enterprise digital infrastructure for management of e-learning in health science. Professor Saroj is an emeritus scientist of the School of Telemedicine and Biomedical Informatics in Lucknow, India. Due to a health issue related to his family, he gently recorded the presentation, and I'm very pleased to present the recorded video here with audio. Okay, so just a moment, please. Here. Where is the other one? Okay, Professor Saroj.
I'll be talking about the National Medical College.
Just stop it to ask if you can hear.
Adolfo, we cannot see the video, just your screen with the different files. Maybe you have to open.
Okay, just a moment, please. All right, let's see if I can return to this one. Here is the video.
I'll be talking about the National Medical College Network. This is a pan-India project being implemented by the Minister of Health and Family Welfare.
Can you
Adolfo,
hear
Now, the
now?
National Medical College
just
Network
Can
we're
hear
just
but not
hearing.
see.
Yeah,
serves to include and network all the medical colleges of the country in a phase-wise manner for the purpose of e-education and National Rural Telemedicine Network for e-healthcare delivery.
Adolfo, we're
In
not
this
seeing the
project,
image.
currently the 50 medical college has
Sorry.
been
Just
included.
the audio, Adolfo.
Just a moment, please. Let me see what happened here. Okay, I will restart again sharing because for some reason it's not. It should be here. Yeah. Robert, can you somehow?
Adolfo, maybe you should first open the video, and after that share the video. Okay.
Just a second, please.
First of all, open the file,
Yeah, but I can't.
and after that share your screen. Okay.
Okay, just a moment, please, because this was expected to be here. Here is the presentation, okay? Unfortunately, let me see, why not? Can you see now?
Yes. Yes.
Network.
Can hear?
This is a pan-India project
Yes.
being implemented by the Minister of Health and Family Welfare. Now, the National Medical College Network, as it means that we are envisaged to include and network all the medical colleges of the country in a phase-wise manner for the purpose of e-education and National Rural Telemedicine Network for e-healthcare delivery. And in this project, currently the 50 medical college has been included, and out of which one center, that is our center, has been identified as National Resource Center, and there are 7 other regional resource centers located in different geographical region of the country. And 42 medical colleges from all over the nation has been included from each state and union territories. As you go along in different phases, the subsequent medical college will also be included. Highly secured, scalable, fast gigabyte network backbone was also developed in the entire country, connecting many of the educational institutions, which is called a national knowledge network. Now, these NMCN objectives were to give knowledge to the medical colleges where there are lack of expert teachers, and at the same time to create knowledge repository of the e-books, e-journals, and open sources web knowledge resources, capturing all the webinars and CMEs conducted by leading medical centers and keeping it as a portal and subsequently put in the cloud. Then also will remotely monitor the surgical skills and also give guidance to telementoring and also give physicians support to managing difficult clinical cases. Then of course, we talk of the tele-education for clinical ground round, clinical bedside rounds, master classes, sharing surgical interventional skills, and virtual classroom for capacity building. We also require specialists to give consultations in all the medical specialties have been listed in the left side of the slides, and also to develop capacity for paramedical staff working in different medical colleges. And this National Medical College Network, as depicted in this diagram, is covering the entire country. As you can see, here is regional wise distributions: north, south, east, west, and northeast. and gradually it will encompass many other medical colleges. We have total of 500 odd medical colleges in the country, out of which there are some government and private medical colleges. As you can see in this slide, depicted in the different color codes, so depicting different states in where one or two medical colleges has been taken from each of the states and union territory to represent the entire country. The soft launch of this project was made in the year 2009, exactly on 14th of January. And as you can see, after that, we imparted training to all the manpower deployed in all these centers. And after training, we then implemented this project. And currently, we are doing current review meetings every month with all the resource centers as well as medical colleges, and prepare meeting minutes and submit it to the Minister of Health. As you see here, this is the depicted diagram for how we manage this project. So, we at National Resource Center are responsible for the day-to-day management of the entire network. However, in the ministry, we have a e-health division and the e-health consultant, and they manage with the project from their end, and having an operational manager and project coordinators. And in the medical colleges, we have content developer and the telemedicine technician. The two of them are located in each medical colleges. And here we have 42 medical colleges, 7 resource centers and 1 national resource centers. As you can see here in this slide, that we have different activities that is undertaken at the National Medical College Network National Resource Center, that is at Lucknow, where I am working. Here you can see here we are responsible for the entire network as depicted in these slides. We are responsible also to share the lectures coming from different parts with our MCU located here and distribute them. And so, live streaming of the facility of skill oriented courses, live surgical transmission. We offer technical assistance and troubleshooting. We have manpower more than the other locations to support these activities. And we also help them to develop their capacity and train the people, and we have the authority to manage the centralized portal of the contents, and giving authority for the peripheral resource centers to upload their content generated there. And we also report the monthly activity to the ministry after doing the review meetings with all the nodes. And also currently we are looking after the activities under the health and wellness project, where the telecare or the peripheral primary centers are also taking place. Similarly, at regional resource centers level also, they also have this kind of support to their medical colleges in that region. Here is some snapshots of the one of the nodes in the medical college in western part of India in Mumbai. You can see how it looks like when the college students they participate in these online sessions. And this is the picture that is at the National Resource Center at Lucknow, where you can see there is the integrated digital operation theatre. We have a high tech digital lecture theatre here with edge blending projector, and also we have decision support system with the multiple physicians placed there, and we have a surgical telepresence suite where the live transmissions are taking place with remote assistant, and all facilities for streaming both to the terminal devices of mobile phone or desktops or laptop or tablet, that is possible. So, we have all the technical resources at National Resource Center. So, here is a activity snapshot. Here you can see here the clinical decision support system, where the physicians from different specialties are taking part to solve a complex case in peripheral medical colleges. We have a data center focused. Till now we have not migrated to the cloud because of the safety concern of the patient data. Here you can see the portal at the Lucknow National Medical College Network portal, or nmcent.in. Please have a look at this portal. You will find thousands of the lectures and seminars and webinars all been archived, and down below you can see here the logo of all the resource centers, 7 resource centers who are contributing to this content. As you can see in this table, you can see the data of the recorded lectures. It is exponentially rising from the year 2019 when it was launched, and achieved 2,325 videos per year. And here are the activities spread over different resource centers here, and you can find here currently our total session in 2021 till now is 22,240, which has come up from 14,000 in 2019. We also take care of the capacity development of our medical staff as well as the technical staff deployed in peripheral medical colleges. And here in Delhi, we have called all of them and given them training how to develop content and how to manage this telemedicine platform. During COVID period, we took a very special measure. Here you can see here entire lockdown period, because of our network existing there, we could support the peripheral centers. This is the data of our place in Lucknow. Similarly, all the medical colleges where the infrastructure is there, so they also offered assistance to the patients during COVID time in a complete lockdown. Also same time the educational activities, because our academic centers are there, and today is the session only for medical students. So here you can realize the importance. I am sure you must be practicing it also in your own hospitals. Online educational programs, not only for doctors, also for the technicians as well as the nurses. And you can very safely practice the skill demonstration of live surgery, etc. through these things. At the same time, also we take classes for the nurses and also the medical technology paramedical workers. So here is the medical video lectures you can find in our portal. They are classified, catalog to subject wise and also specialty wise. So you can have a look at it, it's open, then no password is required. Here we have given technical assistance to all the peripheral healthcare workers during COVID times, how to manage virtual ICU, how to manage the COVID patients at the bedside. All these things, the capacity development building also, because of this network was there, so we could manage to give this support through using this software video conferencing facilities. And many of these exams, the exit exams could be managed through this online mode using this existing network. That is very much in handy to make their exit exam possible during this time. So you can see what the utility of this enterprise network, how it has helped. Of course, any other medical college not having very high bandwidth like we have also managed to undertake activities that we did also here. I am sure you must be also doing the same thing in your colleges. One of these pictures that I am showing it here from our peripheral resource centers colleagues, this is at Chandigarh. We have postgraduate institute there. Some snapshot I am sharing from Puducherry, it is in the south of India. There is another resource center called JIPMER, and also we can see one classroom in KEM hospital in Mumbai. So there are some of the examples I am showing it here, that how similar kind of activities they are also doing there and how they are helping to disseminate the knowledge and the skills. One thing that I want to share with you, currently we are in a transition mode where we are taking the help of our national mission, the national program of technology enhanced learning of the Ministry of the Education, where they are launching this SWAYAM portal. SWAYAM means it is a Hindi word, SWAYAM means it is self-reliant. So we are making our own knowledge archived, and also we will undertake MOOC courses. With the MOOC course, we are also developing capacity building. So here on we will have take the help of the national portal of SWAYAM and store all our content there and make this online access available to all our stakeholders. This is our School of Telemedicine and Biomedical Informatics. We run our courses and skill development programs in digital health. So if you are visiting our country anytime, do let us know. So we will invite you to our centers. Thank you very much for your kind attention.
Okay, well, I thank very much Dr. Saroj Mishra from India for sending this interesting video and with this full content of information about, involving more than 50 academic institutions across the country. So now, as we concluded the fourth presentation, I'm very pleased to invite our distinguished presenters, panelists to participate of a discussion. And also to answer to some eventual questions from the audience. So the discussion is open now. I have one question directed to all participants that comes from, I don't know, the AHA. What is the biggest challenge during your experience in telemedicine? So what's the biggest barrier for the implementation of academic and assistant telemedicine projects? Who would like to say some words about this? The biggest challenge during experience in telemedicine.
Pico, please.
Hello?
Yes, we can hear you.
Okay, I think that my country is small considered to India and Brazil, but we have a recent study, but amazing that the attitude of the personnel, that they need to have a positive attitude to adopt new services and change their work. It's not a matter of if we don't have tools or connections, but it's the kind of resistance to change your own work. That's one, I think, in Finland.
Professor Valerie, what is your
Yes.
opinion? What are the major barriers to implement telehealth, telemedicine across Russia?
In Russia now we have very big official project by our health ministry. For me, to work together with health ministry sometimes fine money, but sometimes bad because very strong rules. For me now it's more interesting project to trans-border distance video consultation. It's very interesting and very difficult because special rules for data protection and different kind of technology, video conference channels, and so on. I think it's future. Also, we have some new project for additional possibilities for distance video consultation, such as stereo, such as how it's in English. Also, some special possibilities for physicians, for skin and so on, because I must look the skin, I must check the skin of my patient and so on. It's interesting.
Professor
And now in our
Alexander.
country, I want to add,
Yeah.
very popular after COVID, special platforms for video conference for discussion between patient and physician. It's very interesting, but it's very difficult because nobody, now we have that special program, special education program for physicians. Because as example, you have physician and I'm patient, I have no experience. You must know how you can stop the conflict between physician and patient. It's a very difficult problem because nobody know this.
Okay. Professor Alexander, in that sense, I have a comment because we could see that you started several years ago, step by step, and created postgraduate education program for the graduate activities for the graduation period and the post-graduation. But now we see that you also have a program that moves from the university to the schools, primary schools. So is that important in order to train people before coming to the university so they can learn before going to the academic world, I should say. So that's the reason why you started this program with schools. And is that limited to the state of Rio de Janeiro or other states are involved in this program?
Thank you for the question. I agree with Pico. The most problem to my mind, to our experience here in Rio de Janeiro State University and also in Brazil, is people, how to engage people, how to prepare people to work on digital health initiatives. Otherwise, technology is all the time in our lives. It's very interesting because you use all the time mobile solutions such as cellular phone, but to get this technology through digital health, I think it's very difficult. So to answer the question, to my mind, engage people. We must engage people and prepare them to deal with technology, to work with patients, like Valerie has said, how to attend the patients in ethical way. So that's my mind. And concerning the at schools, when we planned this project is exactly to engage people even in the teenager, because they are teenager. And it's very nice because they bring a lot of challenges to us because they know technology, they have less resistance to technology, but they really don't know how to deal with. So it's very nice. That's the point, to engage people, even the teenager.
Okay, thank you. We have yes, please, Mr. Frank Levins.
Yeah, I want to take over. In addition to what we just said, there are two more, I think, very interesting questions. I read it, you can probably see it on your screens as well, from Dr. Romayo Rojas, who just joined the ISfTeH. Welcome, as a matter of fact, from the Philippines, and saying thank you for all the speakers for a very informative webinar. May I know how do you resolve the problem of poor internet connection in areas where telehealth is much needed? Well, this has always been a problem and will probably always be, but it evolves. And if we can see what we can do technologically, even on internet, nowadays, as compared to 20 years ago, it's already a major thing, but it's still a problem to reach out. And that's the technology companies, and also the politicians in a way in each country, whether they want to invest in better internet implementation. We all depend on that. It's true. We depend on electricity. If tomorrow, if right now during this meeting, the electricity somewhere falls out, well, it's over. It's done. And that's also one of the major handicaps or risks when you deal with health and patients, because if it happens at a critical moment, that could affect the patients could die, obviously. So surgery, robot surgery certainly includes that kind of risk. Okay, this being said, there was a further question, which was about should digital education be integrated into already existing medical educational curriculum? Of course. And this is what we have been advocating for all the time at ISfTeH. And this is also what was at the basis of starting up this consortium of educational institutions in digital health. Yeah, and so we hope that with a coordination between those institutions that already deliver some kind of degrees or certificates, can also encourage other institutions, all the institutions around the world that we're talking about in the medical or health field, whether it's biomedical, whether it's nursing, whether it's just medical, for the future, to also incorporate digital or telemedicine courses within the curriculum, even on regular medical schools from the very first year. There should be at least a few courses to the first year students, that introduce them to that, and as long as they go, and certainly when they specialize. And your presentations have all shown what can be reached and done also in a very practical way, which will in the end all serve the patients. Today we concentrate on the existing and technical possibilities at the level of education towards the students, but it's true that it's through the students who are going to be the next generation of professionals in doctors, surgeons, whatever, and they are the ones who will deal with the patients, hopefully, thanks to that the use of technology, also in a better way. And in fact, we are very much helped now by Corona, by COVID-19, because even at regular high schools, universities, independently from the medical faculties, they've all gone or had to go, whether they liked it or not, to distance learning and using, the video. I think it's definitely not the ultimate solution. Probably it will be a mix, and depending again on how the whole pandemic will evolve, this generation, the new generation of students, is going to get used to use both. And that helps, of course, what we have tried to advocate regarding telemedicine. It has proven itself. COVID has helped us, in fact. So yeah, we will see. It's still the exciting thing about this is it's going to be there forever. There is no way back, and it will continue to evolve as we go. And yet, with two very important remarks, sideline remarks. A, it's all about the patient. So it must serve the patient. If it doesn't serve the patient, forget about it. And secondly, you know, we the humans, the people, must master the technology. If we allow technology to take it too far, that's personally, I have questions around, you know, the some practices that develop. Technology can do everything if you let it be, if you let it go, but we must control it. If we can no longer control it, we are creating a pandemic in itself. And that is a message that needs to be said and repeated all the time. And therefore, it's also so important that between the professionals, the health professionals, and the industry, the technology, there would be a permanent dialogue so that both understand well. When I said yes, there should be some from in the very first year of the students that there should be courses about the technology. Also in engineering schools, in computer schools, and for those who want to specialize on health applications, there should be courses, you know, to teach what it is all about in health that is so important to take into account when you develop programs, platforms, whatever. And so if we keep that in mind, the future is not only ours, we won't be there in 30 years, but our children, our grandchildren, the 21st century generation, I think. And yeah, I believe in it strongly, even if myself, I'm not really very good at anything in technological at all. But I would not mind to be served as well in a certain way by that if I need it as a patient. These are my remarks.
Thank you very much, Mr. Frank Livings, for this review on telemedicine and the health. Fantastic. We still have some time. If you would like, if someone want to say some additional words, please feel absolutely free. I don't have other questions from the audience. Anyway, that was an outstanding opportunity for discussion. In fact, not just limited to education, but also some practical demonstrations of education via communication, etc., from different countries. So that was really an outstanding moment for this webinar directed to student members.
Jefferson, would you have some words to add to all this?
Yeah, sure. Thank again for all the speakers for their very, very interesting presentations, their experiences. I think we have a lot to say regarding the education of graduate and postgraduate students, but also professionals, because the exponential growth of digital health driven by this pandemic showed the need of the training and education in a broad sense of professionals that are already in the field, specialists or nurses, physical therapists, and so on. So this is something that is growing. And as regard to this relationship between the health professional and the patient, this is something that also needs to be learned how to do it through a virtual platform. It's different when you are in person, but how to show confidence, how to be warm, and how to be to bring this the human relationship through this platform. So this is something that can and should be trained as well. And so, but to teach people, those who teach has also to learn. So we need more and more professionals that are experienced in the use of e-health in all sense, and of telemedicine and of telehealth, and mainly in this modality of teleconsultation, because this is the front line of everything, you know, to help people that they present their problems and they present their lives for us to try to help them. So this is very important. So it's never enough to say that we need education, continuous education. And of course, when you go to the broader sense of digital health, when you have these new solutions, you know, that help to support diagnostic or even therapeutic, we must be really aware, you know, what is the best way to evaluate this. You know, some countries, as Germany, now allow physicians to prescribe you know, digital solution and digital therapeutics. But these therapeutics need to prove their benefits, if to prove that they deliver what they promise to deliver. And this come with clinical trials, specific methodology, easier than the drug trials, but it's needed. Otherwise, we're going to fool ourselves using things that are not really helping safely to diagnosis and also to treatment. So it comes to artificial intelligence. Maybe it's better to call it assist intelligent, or even, I'm not sure if you know, we should call it intelligence, because the idea is to know, tell them as the solution as similar to human intelligence, which is not. So people, physicians and health professionals need to learn about that, need to learn the benefits and the limitations of digital solution, of AI, need to learn the benefits and the limitations of telemedicine to provide the responsible care of a patient. And by responsible, I mean with ethics, with safety, and with quality. Telemedicine, telehealth are not tools. Tools are the hardware, are the software. Telemedicine, telehealth are methods of taking care of people. And as a method, it should be learned. So this is something that is a continuous process. And it's important to keep in mind that if a health professional is not a good professional in face-to-face care, probably he or she is not going to be also a good professional virtually. So we have to keep that in mind and not blame the technology only for the problems that may arise. So I just tackling some aspects that reinforce the need for the education and for training of health professionals. It's a global need, and we are seeing lots of developments, and we need to learn how to use these methods in a proper way, in a responsible way. These are some of my contributions to the discussion.
Thank you.
Thank you very much. Well,
and
still
also,
open.
before closing, I would like to point out this webinar, like the others, is recorded. So, well, I see there have been about 10, 12 attendees, not that much, but I think those attendees can spread the word to those who are not able to join, especially students that they know in their entourage, to go on the website of the ISfTeH under the chapter education, and then subchapter past webinars. And on clicking on this webinar, you will post it within the next day or two, and so people will be able to review again this webinar plus all the slide presentations, and still address questions to the society or to us. It will be glad to answer them as well as possible. And also, don't forget, telemedicine, or let's go with digital health, is global, is international. And we're glad through the society to be able to reach out to so many countries. We're happy that There were presentations from different continents, from different parts of the world, north, south, east, west, and we'll certainly continue to do so over the coming years as one of the activities of the students' membership. There you go.
Okay, in order to conclude this session, to end this webinar, I thank you very much for all presentations in this afternoon and morning hours here, and also thank the audience for participating. So that's very important for us. So good luck, thank you very much, and please pay
Bye-bye.
attention to the ISfTEH website because new webinars are planned. Thank you, goodbye.
Thank you.
Thank you.
Bye-bye.
Спасибо.